I have seen the people in my congregation talk more about health since I have talked more about it, and since this whole issue has come up. I think they would access it. I think they would use it. I think it would give them opportunity now to have the ability to have a primary physician, which I keep harping on that because I think that's so important. I think having regular contact with a physician that you become comfortable with when you have the aches and pains of life, when things happen, you have someone you can call instead of going to a ER room where you have someone new every time. I think we are people of relationships. We are people of relationships, and forming those kinds of relationships will be beneficial in so many ways. We're talking about health. It would be very beneficial because we are people of trust. And if we can form trust relationships with individuals, that's what happened with me. I come in as a pastor and I have to develop trust with this congregation. I'm not a member of this church. I'm just the leader of this church. And if I develop this trust with them, they will talk to me. They will share with me. Likewise with doctors, with dentists, with all of the rest of the medical healthcare professionals that they need to do that with. If they can have one person, and I think this will provide them that. It is expensive. It is expensive to have a doctor. It's expensive to go through some of the tests and things, but I think people would be more apt to do it sooner than later if they had some resources to be able, or some help to be able to go. So I think it would mean a lot to not only my congregation, because I'm in the community. I can see it from many standpoints that it would be very, very helpful to the congregation to the community as a whole to have some type of support for health care for all individuals in the state of Oklahoma.